I'm grateful for the opportunity to speak with you today as a pediatrician, as an infectious disease specialist, but most importantly, as a parent. I'm a parent of a teenager and a young adult. We live in part of the country where less than 50% of us are vaccinated against COVID-19. We, like you, live in part of the country where we're facing a third surge of COVID-19 infections. Record number cases of infections, hospitalizations, and deaths. The reality is that 22% of our country is made up of children. As of July 29th, 2021, more than 4.2 million children have contracted COVID-19 infections. So we know so much more than we did at the beginning of this pandemic when we were unsure about whether or not children actually got infected or how severely. We know now that children do get severe infections, they do require hospitalizations, and they do die. There are conditions like multi-inflammatory syndrome, where kids get infections that affect their heart, lungs, kidneys. There's another condition called Longhaul Syndrome, which affects both adults and children. We're still learning about that. I have a colleague actually who her entire family contracted COVID. And after they recovered, her son, her teenage son, who plays in a lot of different sports, continues to battle with gastrointestinal issues and also fatigue 6 months after his infection. My own daughter contracted COVID in March of 2020 and continues to suffer from fatigue. She lost her sense of smell and taste for more than 6 months. Since then, she's received the Moderna vaccine, and we are hopeful that after taking a year off from school that she will start and finish up her last year of college this coming fall. As we move through the second year of this global pandemic, we do have effective countermeasures to prevent further transmission and infections. And that is in the form of these COVID-19 vaccines, along with social distancing and masking. I'm the principal investigator for one of the 4 HBC medical schools participating in the U.S. COVID Prevention Network. And as part of that network, we participate in the COVID-19 vaccine trials and therapeutics. I know that it is safe and effective. More than 190 million of us in this country have been vaccinated, but there's so many, especially those who are less than 12, who still cannot get the vaccine. So for the rest of us who are eligible, I'd like you to consider to take the COVID-19 vaccine. And if you have a child over 12, please consider to talk to your pediatrician and address any concerns you have, and then consider to give them the COVID-19 vaccine, also to give them the influenza vaccine as we move through this influenza season. We need to do our part to get to the other side of this pandemic.